Question 1. When evaluating potential suppliers for a critical medical device, a healthcare procurement professional must consider various factors beyond the immediate price quotation. Which of the following approaches best aligns with the regulatory framework and ethical guidelines for certified healthcare procurement professionals, CHPP, in ensuring a resilient and responsible supply chain? Option A. Focusing exclusively on suppliers located within the same geographic region to minimize transportation costs and lead times, disregarding other critical supplier attributes. Option B. Selecting the supplier offering the lowest upfront cost for the medical device, assuming that competitive pricing inherently reflects a well-managed and efficient operation. Option C. Solely engaging with suppliers who have been long-term partners of the healthcare organization, without conducting a current assessment of their performance, ethical compliance, or supply chain resilience. Option D. Prioritizing suppliers who can demonstrate robust quality management systems, ethical labor practices, financial stability, and a clear plan for supply chain continuity, even if their initial pricing is slightly higher than competitors. The correct answer is D. Prioritizing suppliers who can demonstrate robust quality management systems, ethical labor practices, financial stability, and a clear plan for supply chain continuity, even if their initial pricing is slightly higher than competitors. Explanation. This scenario presents a common challenge in healthcare procurement, balancing the immediate need for critical supplies with the long-term strategic imperative of supply chain resilience and ethical sourcing. The professional challenge lies in navigating the complex interplay between cost-effectiveness, regulatory compliance, and the ethical obligations to ensure patient safety and fair labor practices throughout the supply chain. A procurement professional must exercise sound judgment to avoid short-sighted decisions that could jeopardize patient care or lead to reputational damage and legal repercussions. The correct approach emphasizes a holistic evaluation of potential suppliers, moving beyond mere price to consider a broader spectrum of factors crucial for a robust and ethical healthcare supply chain. This includes assessing a supplier's financial stability, their capacity to meet demand fluctuations, their quality control processes, their adherence to ethical labor standards, and their commitment to sustainability. Such a comprehensive due diligence process aligns with the principles of responsible procurement, aiming to mitigate risks associated with single-source dependencies, product quality issues, and ethical breaches. It reflects best professional practice by prioritizing patient safety and the long-term viability of the healthcare organization's supply chain, adhering to regulatory frameworks that mandate due diligence and risk management in procurement. An approach that solely focuses on securing the lowest upfront cost, while seemingly cost-effective in the short term, represents a significant regulatory and ethical failure. This narrow focus ignores potential hidden costs associated with poor quality, supply disruptions, or reputational damage stemming from unethical supplier practices. It fails to comply with regulations that often require risk assessments and the establishment of resilient supply chains, particularly for critical medical supplies. Furthermore, it can lead to ethical breaches by implicitly condoning or overlooking exploitative labor practices or environmental degradation within the supply chain, which can have severe consequences for patient well-being and public trust. Another incorrect approach, prioritizing only suppliers with established, long-standing relationships without a current assessment of their performance or ethical standing, also poses risks. While established relationships can offer benefits, they do not guarantee continued compliance with current regulations or ethical standards. Failing to periodically reevaluate suppliers can lead to overlooking emerging risks, such as changes in a supplier's financial health, quality management systems, or adherence to evolving labor laws. This oversight can result in a breach of due diligence requirements and expose the organization to supply chain vulnerabilities and ethical compromises. The professional decision-making process for similar situations should involve a structured risk-based approach. Procurement professionals should first identify critical supply chain components and assess potential risks associated with each. This assessment should then inform the supplier selection criteria, which must extend beyond price to include factors like quality, reliability, ethical practices, and sustainability. Regular performance monitoring and reevaluation of suppliers are essential to ensure ongoing compliance and mitigate emerging risks. Collaboration with legal, compliance, and clinical departments can further strengthen the decision-making process, ensuring that all relevant regulatory and ethical considerations are addressed. Question 2. Strategic planning requires a comprehensive understanding of the inherent risks associated with different types of healthcare procurement. When developing a procurement strategy for a large hospital system, which approach best aligns with U.S. federal regulatory frameworks and best practices for managing the distinct risk profiles of direct, indirect, and capital expenditures. Option A. Prioritizing a thorough risk assessment for each procurement category, considering regulatory compliance, patient safety, operational continuity, and financial viability to inform mitigation strategies. Option B. Delegating risk assessment responsibilities solely to individual department managers without a centralized oversight mechanism. Option C. Focusing primarily on achieving the lowest unit cost for all procurement categories to maximize immediate budgetary savings. Option D. Expediting the acquisition process for all procurement types to ensure rapid availability of goods and services, regardless of potential long-term implications. The correct answer is A. Prioritizing a thorough risk assessment for each procurement category, considering regulatory compliance, patient safety, operational continuity, and financial viability to inform mitigation strategies. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of how different types of healthcare procurement, direct, indirect, and capital, carry distinct risk profiles, and how these risks must be proactively managed within the specific regulatory framework governing healthcare procurement in the United States. The challenge lies in accurately identifying and prioritizing these risks to ensure compliance, cost-effectiveness, and the uninterrupted delivery of patient care. The correct approach represents best professional practice because it systematically assesses the inherent risks associated with each procurement category. Direct procurement, involving items critical to patient care, e.g., pharmaceuticals, medical devices, carries high risks related to supply chain disruption, product quality, and regulatory compliance, e.g., FDA regulations. Indirect procurement, e.g., office supplies, IT services, has risks related to vendor lock-in, data security, and operational efficiency. Capital procurement, e.g., major medical equipment, facility upgrades, involves significant financial outlay, long-term commitments, and potential obsolescence, with risks tied to project management, financing, and technological advancements. A comprehensive risk assessment framework, aligned with federal procurement regulations like the Federal Acquisition Regulation, FAR, and specific healthcare statutes, e.g., Stark Law, anti-kickback statute implications for vendor relationships, is essential for mitigating these diverse risks. This proactive approach ensures that procurement strategies are robust, compliant, and support the organization's mission. An incorrect approach that focuses solely on cost reduction without considering the risk of supply chain disruption for direct medical supplies would be a significant regulatory and ethical failure. This could lead to shortages of essential patient care items, directly impacting patient safety and violating the healthcare organization's duty of care. Furthermore, it could inadvertently lead to the procurement of substandard or counterfeit products, posing serious health risks and violating FDA regulations. Another incorrect approach that prioritizes speed of acquisition for indirect IT services over robust data security protocols would be a failure. This exposes sensitive patient data to breaches, violating HIPAA regulations and ethical obligations to protect patient privacy. The long-term financial and reputational damage from such a breach far outweighs any short-term gains in efficiency. A third incorrect approach that involves entering into long-term capital equipment leases without a thorough analysis of technological obsolescence and future serviceability would be a financial and operational failure. This could result in the organization being locked into outdated technology, incurring unnecessary maintenance costs, and failing to leverage more advanced, cost-effective solutions, thereby mismanaging organizational resources and potentially impacting the quality of care. The professional decision-making process for similar situations should involve a multi-stakeholder approach. Procurement professionals must first understand the strategic objectives of the healthcare organization. Then, they must categorize procurements and conduct a thorough risk assessment for each, considering regulatory compliance, patient safety, operational impact, financial implications, and ethical considerations. This assessment should be informed by current federal regulations and industry best practices. Mitigation strategies should be developed for identified risks, and these strategies should be integrated into the procurement plan and contract terms. Regular review and adaptation of these strategies are crucial to address evolving risks and regulatory landscapes. Question 3. Compliance review shows a potential vendor, who is also a significant referral source for the healthcare organization, is offering a substantial volume-based discount on medical supplies. This discount is contingent upon the organization purchasing a specific minimum quantity of supplies annually. The procurement team is eager to leverage this cost-saving opportunity. What is the most appropriate next step for the healthcare organization's procurement department? Option A. Accept the discount and document it internally as a cost-saving measure, assuming the vendor's offer is legitimate and compliant. Option B. Conduct a thorough legal and compliance review, including consultation with healthcare legal counsel, to assess potential violations of federal healthcare regulations, such as the anti-kickback statute and Stark law, before accepting the discount. Option C. Negotiate a fixed discount percentage with the vendor that is not tied to purchase volume to avoid any potential regulatory concerns. Option D. Immediately implement the discount program to realize the cost savings, as volume discounts are standard business practice. The correct answer is D. Immediately implement the discount program to realize the cost savings, as volume discounts are standard business practice. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare procurement where a seemingly beneficial discount could inadvertently lead to non-compliance with federal regulations. The professional challenge lies in balancing cost-saving opportunities with the stringent requirements of federal healthcare procurement laws, particularly those related to Stark law and anti-kickback statute acts. Misinterpreting or overlooking these regulations can result in significant financial penalties, reputational damage, and even exclusion from federal healthcare programs. Careful judgment is required to ensure that any arrangement, including discounts, does not constitute an illegal inducement or violate physician self-referral prohibitions. Correct approach analysis. The correct approach involves a thorough legal and compliance review to determine if the proposed discount structure could be construed as an illegal inducement under the AKS or a violation of the Stark law. This requires understanding the specific definitions of remuneration and inducement within these federal statutes, and assessing whether the discount is tied to the volume or value of referrals. Consulting with legal counsel specializing in healthcare law is paramount to ensure the arrangement adheres to safe harbors or exceptions, thereby protecting the organization from regulatory scrutiny and potential penalties. This proactive, risk-averse strategy aligns with best professional practice by prioritizing compliance and mitigating legal exposure. Incorrect approaches analysis. One incorrect approach is to immediately accept the discount based solely on the potential cost savings. This fails to acknowledge the complex regulatory landscape of healthcare procurement and the potential for such discounts to violate the AKS or Stark law. The ethical failure lies in prioritizing financial gain over legal and ethical obligations. Another incorrect approach is to implement the discount without any legal or compliance consultation, assuming that a standard discount is inherently permissible. This demonstrates a lack of due diligence and a disregard for the specific nuances of federal healthcare regulations. The regulatory failure is the assumption that all discounts are compliant, ignoring the potential for them to be considered illegal remuneration or inducements. A third incorrect approach is to seek advice only from the vendor offering the discount. This creates a conflict of interest, as the vendor's primary motivation is to secure the sale, not necessarily to ensure the procurement organization's compliance with federal law. The ethical failure is relying on a party with a vested interest to provide objective compliance guidance. Professional reasoning. Professionals in healthcare procurement must adopt a risk-based decision-making process. This involves identifying potential regulatory risks associated with any procurement activity, especially those involving financial arrangements with healthcare providers or entities that generate federal healthcare program business. The process should include 1. Understanding the relevant federal and state regulations, e.g., Acts, Stark Law, HIPAA, PPACA. 2. Conducting a risk assessment to identify potential compliance gaps. 3. Consulting with legal and compliance experts to interpret regulations and assess the legality of proposed arrangements. 4. Documenting all compliance reviews and decisions. And 5. Implementing robust internal controls to monitor ongoing compliance. When faced with a situation like the one presented, the professional should always err on the side of caution and seek expert legal and compliance advice before proceeding. Question 4. Strategic planning requires a healthcare procurement professional to reevaluate the current inventory management system for critical medical supplies. The organization faces pressure to reduce carrying costs associated with maintaining large stockpiles, yet must also guarantee uninterrupted availability for patient care. Considering the U.S. regulatory framework for healthcare procurement, which inventory management approach, when thoughtfully implemented, best balances these competing demands. Option A. Adopt a maximum stock level approach for all critical supplies, setting high thresholds to ensure no item is ever out of stock, regardless of holding costs. Option B. Implement a modified just-in-time JIT system, focusing on strong supplier partnerships and accurate demand forecasting to minimize on-hand quantities while ensuring timely replenishment. Option C. Primarily rely on the theoretical economic order quantity (EOQ) model to determine order sizes, assuming stable demand and cost structures for all medical supplies. Option D. Maintain current inventory levels, as any reduction risks compromising patient care, and focus solely on negotiating better unit prices for existing stock. The correct answer is B. Implement a modified just-in-time JIT system, focusing on strong supplier partnerships and accurate demand forecasting to minimize on-hand quantities while ensuring timely replenishment. Explanation: Scenario analysis. This scenario presents a common challenge in healthcare procurement, balancing the need for readily available critical supplies with the financial implications of holding excess inventory. The pressure to reduce costs while ensuring patient care is paramount. The procurement professional must navigate conflicting demands, understand the nuances of different inventory management techniques, and apply them within the specific regulatory framework governing healthcare procurement in the U.S. Failure to do so can lead to stockouts, patient harm, and financial penalties. Correct approach analysis. Implementing a just-in-time JIT inventory system, adapted for the healthcare context, represents best professional practice. This approach, when carefully managed, minimizes holding costs by receiving supplies only as they are needed for patient care. In the U.S. healthcare regulatory environment, this aligns with principles of efficiency and waste reduction, indirectly supporting cost containment efforts mandated by payers and government programs. Ethically, it ensures that resources are not tied up in dormant stock, allowing for reinvestment in patient care services. The key is a robust supplier relationship and accurate demand forecasting to prevent stockouts, which are critical in a healthcare setting. Incorrect approach is analysis. Adopting a purely maximum stock level approach without considering demand variability or lead times is problematic. This can lead to excessive inventory, increasing storage costs, risk of obsolescence, and potential for expired or damaged goods, which is a failure to manage resources efficiently and ethically. It also fails to leverage modern inventory management principles that emphasize responsiveness. Implementing a first-in, first-out FIFO system solely as a cost-saving measure without a comprehensive inventory management strategy is insufficient. While FIFO is a valid method for managing stock rotation, it does not inherently address the core issue of overstocking or understocking. It can lead to higher holding costs if applied to an unnecessarily large inventory. Focusing exclusively on economic order quantity (EOQ) calculations without considering the dynamic nature of healthcare demand and the critical need for immediate availability is a significant flaw. EOQ is a theoretical model that assumes stable demand and costs, which is rarely the case in healthcare. Over-reliance on EOQ can lead to either insufficient stock during surges in demand or excessive stock during lulls, both of which are detrimental to patient care and financial health. This approach can also be seen as a failure to adapt theoretical models to the practical realities of the healthcare environment, potentially violating ethical obligations to ensure supply continuity. Professional reasoning. Healthcare procurement professionals must adopt a data-driven and adaptable approach. This involves understanding the specific needs of the organization, the criticality of different supplies, supplier reliability, and the regulatory landscape. A thorough risk assessment of potential stockouts versus holding costs is essential. Professionals should leverage technology for demand forecasting and inventory tracking, and cultivate strong relationships with suppliers to ensure timely deliveries. The decision-making process should prioritize patient safety and care continuity, followed by financial stewardship and regulatory compliance. Question 5. Cost-benefit analysis shows that a group purchasing organization, GPO, contract offers significant potential savings on essential medical supplies. However, the GPO's rebate structure is complex and appears to offer a tiered rebate that increases disproportionately with higher purchasing volumes, potentially exceeding the documented savings on the supplies themselves. The GPO representative suggests that maximizing purchases through their network is the most effective way to realize the full rebate benefit. As a certified healthcare procurement professional, CHPP, what is the most ethically sound and professionally responsible course of action? Option A. Seek independent legal and financial counsel to thoroughly review the GPO contract and rebate structure, ensuring compliance with all applicable regulations and organizational policies, and then proceed with negotiations based on that expert advice. Option B. Inform the GPO that the rebate structure is concerning and propose a simplified fixed rebate percentage, even if it means forgoing some of the potential savings outlined by the GPO. Option C. Accept the GPO's explanation of the rebate structure and proceed with the contract, assuming their representation is accurate and that the primary goal is cost savings. Option D. Immediately negotiate the contract, focusing on maximizing purchases to secure the highest possible rebate, as the GPO representative has indicated this is the intended benefit. The correct answer is D. Immediately negotiate the contract, focusing on maximizing purchases to secure the highest possible rebate, as the GPO representative has indicated this is the intended benefit. Explanation. This scenario presents a common ethical dilemma in healthcare procurement involving group purchasing organizations, GPO. The challenge lies in balancing the pursuit of cost savings, a primary objective of GPOs, with the imperative to maintain ethical conduct and ensure fair competition. The healthcare procurement professional must navigate potential conflicts of interest and uphold their fiduciary duty to their organization and the patients it serves. The correct approach prioritizes transparency, adherence to GPO contract terms, and a thorough understanding of the GPO's rebate structure. It involves proactively seeking clarification on any perceived ambiguities in the contract and ensuring that all financial benefits received are properly disclosed and aligned with organizational policies and regulatory requirements. This approach upholds best professional practice by fostering trust, preventing potential fraud or abuse, and ensuring that purchasing decisions are driven by value and patient care needs, not solely by undisclosed financial incentives. It aligns with the principles of ethical procurement, emphasizing integrity and accountability. An incorrect approach would involve accepting the GPO's interpretation of the rebate structure without independent verification or seeking clarification, especially if it appears to offer an undue advantage or is not clearly documented. This could lead to regulatory violations, such as kickback schemes or violations of anti-kickback statutes, if the rebates are found to be contingent on purchasing volume in a way that influences clinical decisions or inflates costs. Another incorrect approach would be to ignore potential conflicts of interest, such as having a personal relationship with a GPO representative that might influence decision-making, or failing to disclose the full extent of financial arrangements to the organization's leadership. Such omissions erode trust and can lead to reputational damage and legal repercussions. Professionals should employ a decision-making framework that begins with a clear understanding of their organization's procurement policies and relevant regulations. When faced with complex GPO agreements or rebate structures, they should always err on the side of caution, seeking expert legal and financial advice when necessary. Proactive communication, thorough documentation, and a commitment to ethical conduct are paramount. The process should involve a critical evaluation of all financial arrangements, ensuring they are transparent, justifiable, and in the best interest of the healthcare organization and its patients. Question 6. The control framework reveals an urgent need for critical medical supplies due to an unforeseen public health event. The procurement team is under immense pressure to secure these items immediately to prevent a severe impact on patient care. Given the time constraints, What is the most appropriate best practice approach for the healthcare procurement professional to manage this situation while adhering to regulatory and ethical standards? Option A. Engage in a sole source procurement with a known supplier without exploring competitive options, assuming their reliability in this urgent situation. Option B. Accept the initial quote received from a supplier without conducting any further due diligence or market research to expedite the process. Option C. Immediately initiate an emergency procurement process, seeking the necessary approvals and documentation as per organizational policy for urgent acquisitions, while ensuring transparency and justification for any deviation from standard competitive bidding. Option D. Proceed with purchasing from the first supplier that can deliver quickly, without formal approval or detailed justification, to ensure immediate availability of the supplies. The correct answer is C. Immediately initiate an emergency procurement process, seeking the necessary approvals and documentation as per organizational policy for urgent acquisitions, while ensuring transparency and justification for any deviation from standard competitive bidding. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a procurement professional to balance the immediate need for essential medical supplies with the imperative to adhere to established procurement policies and ethical standards. The pressure to act quickly can lead to shortcuts that compromise transparency, fairness, and value for money, all critical elements in public healthcare procurement. The risk of reputational damage and potential regulatory scrutiny is significant if proper procedures are not followed. Correct approach analysis. The correct approach emphasizes a structured, policy-driven response. It prioritizes obtaining necessary approvals and ensuring compliance with the organization's procurement policies, even under pressure. This aligns with best practices in healthcare procurement, which mandate transparency, accountability, and the demonstration of value. By seeking emergency procurement approval, the professional is adhering to established governance mechanisms designed to manage exceptions while maintaining control and oversight. This approach ensures that the procurement, though expedited, is still subject to appropriate scrutiny and justification, thereby protecting the organization from undue risk and upholding public trust. Incorrect approaches analysis. One incorrect approach involves bypassing the formal approval process to expedite delivery. This is a direct violation of procurement policies and governance frameworks. It undermines the principles of accountability and transparency, as there is no documented justification or oversight for the deviation. This could lead to accusations of favoritism, lack of due diligence, and potentially inflated pricing, all of which are serious ethical and regulatory failures in public procurement. Another incorrect approach is to proceed with a sole source procurement without a documented and justifiable reason for excluding competition. Healthcare procurement regulations typically require competitive bidding to ensure fair market value and prevent corruption. Sole sourcing without proper justification circumvents this fundamental principle, raising concerns about fairness, transparency, and the potential for suboptimal pricing or quality. This failure to explore competitive options is a significant regulatory and ethical lapse. A third incorrect approach is to accept the first available quote without conducting any due diligence or market research. This neglects the core procurement objective of achieving best value for money. It fails to ensure that the price is reasonable or that the supplier is reputable and capable of meeting the required standards. This approach demonstrates a lack of professional rigor and can lead to financial waste and supply chain risks, representing a failure in professional duty and potentially violating procurement principles related to value for money. Professional reasoning. Professionals should approach such situations by first understanding the urgency and the specific needs. However, this understanding must be immediately followed by a review of the organization's procurement policies, particularly those pertaining to emergency or urgent procurements. The decision-making process should involve identifying the appropriate policy pathway, gathering necessary documentation to justify the urgency and any deviations from standard procedures, and seeking the required approvals from the designated authorities. This structured approach ensures that, while speed is a factor, it does not come at the expense of compliance, fairness, and accountability. Question 7. The efficiency study reveals a potential for significant cost savings by switching to a new supplier for critical medical consumables. However, the current contract with the incumbent supplier has 2 years remaining and includes clauses for early termination penalties. The requesting department is eager to proceed immediately to realize the projected savings. What is the most appropriate procurement action to take? Option A. Inform the requesting department that the cost savings are the only factor to consider and proceed with the new supplier, overriding any contractual concerns. Option B. Proceed with the new supplier without formally terminating the current contract, hoping the incumbent supplier will not enforce the termination clauses. Option C. Initiate a detailed review of the existing contract's early termination clauses, potential penalties, and the total cost of switching, while simultaneously exploring the terms and conditions of the proposed new supplier to ensure they meet all regulatory and operational requirements. Option D. Immediately terminate the current contract to secure the cost savings, assuming the penalties will be offset by the projected savings from the new supplier. The correct answer is C. Initiate a detailed review of the existing contract's early termination clauses, potential penalties, and the total cost of switching, while simultaneously exploring the terms and conditions of the proposed new supplier to ensure they meet all regulatory and operational requirements. Explanation: this scenario is professionally challenging because it requires balancing the immediate need for cost savings with the long-term implications of contract terms, particularly in a regulated healthcare environment. The procurement professional must navigate potential conflicts between departmental requests and established procurement policies, ensuring compliance with the Certified Healthcare Procurement Professional (CHPP) standards and relevant U.S. healthcare regulations. Careful judgment is required to avoid compromising patient care or introducing undue risk to the organization. The correct approach represents best professional practice because it prioritizes a thorough review of existing contract terms and conditions, including service level agreements, SLAs, and termination clauses, before committing to a new vendor. This aligns with CHPP ethical guidelines that emphasize due diligence, transparency, and responsible stewardship of resources. It also adheres to U.S. healthcare procurement regulations that mandate fair and competitive bidding processes, risk assessment, and ensuring value for money, while maintaining quality of service. Understanding the implications of contract modifications or early termination fees is crucial to avoid financial penalties and ensure continuity of essential healthcare services. An incorrect approach that focuses solely on the lowest price without scrutinizing contract terms is professionally unacceptable. This could lead to regulatory violations if the new vendor cannot meet the required service levels, or if the termination of the existing contract incurs significant penalties, potentially breaching contractual obligations and exposing the organization to legal action. Such an approach also fails to consider the potential impact on patient care and operational efficiency, which are paramount in healthcare procurement. Another incorrect approach that involves bypassing the established procurement process to expedite the vendor change is also professionally unacceptable. This violates principles of fair competition and transparency, which are fundamental to ethical procurement practices and often mandated by U.S. healthcare regulations. It can also lead to the selection of a vendor that has not undergone proper vetting, increasing the risk of noncompliance with healthcare standards and data privacy laws like HIPAA. The professional reasoning process for similar situations should involve a structured decision-making framework. First, clearly define the problem and the desired outcome. Second, identify all relevant stakeholders and their concerns. Third, gather all necessary information, including existing contract details, market research, and regulatory requirements. Fourth, evaluate potential solutions against established criteria, including cost, quality, risk, and compliance. Fifth, select the best option based on this comprehensive evaluation, documenting the rationale for the decision. Finally, implement the chosen solution and monitor its effectiveness, making adjustments as needed. Question 8. The audit findings indicate a recurring pattern of supply disruptions and quality control issues with several key medical equipment suppliers. What is the most appropriate immediate action for the healthcare procurement department to take in response to these findings? Option A. Conduct a thorough review and enhancement of the existing supplier risk assessment framework and its implementation to identify and address systemic weaknesses. Option B. Immediately terminate contracts with all identified suppliers and initiate a search for new vendors to replace them. Option C. Implement a significantly more complex and time-intensive supplier vetting process for all future procurements, regardless of criticality. Option D. focus solely on expediting the procurement of alternative medical supplies to meet immediate demand, deferring any formal risk assessment review. The correct answer is A. Conduct a thorough review and enhancement of the existing supplier risk assessment framework and its implementation to identify and address systemic weaknesses. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a procurement professional to balance the immediate need for critical medical supplies with the long-term implications of inadequate risk assessment. The audit findings highlight a potential systemic weakness in the procurement process, suggesting that past decisions may have overlooked or underestimated risks associated with supplier reliability and compliance. This puts the organization at risk of supply chain disruptions, compromised patient care, and potential regulatory noncompliance. The pressure to secure supplies quickly can lead to shortcuts, making a robust risk assessment process even more crucial. Correct approach analysis. The correct approach involves a comprehensive review of the existing supplier risk assessment framework and its implementation. This includes evaluating the criteria used for risk identification, the methods for assessing the likelihood and impact of identified risks, and the strategies for risk mitigation and monitoring. Best professional practice dictates a proactive and systematic approach to risk management, ensuring that all significant risks are identified, understood, and addressed before they materialize. This aligns with the principles of good governance and due diligence expected of healthcare procurement professionals, aiming to safeguard the organization's operational continuity and ethical obligations to patients. Regulatory frameworks, such as those governing healthcare supply chains, often mandate robust risk management processes to ensure the availability of essential goods and services. Incorrect approaches analysis. One incorrect approach would be to dismiss the audit findings as a mere procedural formality and continue with existing procurement practices without further investigation. This fails to acknowledge the potential for significant operational and financial risks, violating the ethical duty to act in the best interest of the organization and its patients. It also disregards the importance of continuous improvement and learning from audit feedback, which is a cornerstone of professional development and regulatory compliance. Another incorrect approach would be to focus solely on identifying a new supplier without addressing the root causes of the identified risks. Securing a new supplier might offer a short-term solution. It does not resolve underlying issues in the risk assessment process. This approach is reactive rather than proactive and could lead to similar problems with future suppliers. It demonstrates a lack of strategic thinking and a failure to implement sustainable risk management practices, potentially leading to repeated audit findings and increased organizational vulnerability. A third incorrect approach would be to implement a highly bureaucratic and time-consuming risk assessment process that significantly delays the procurement of essential medical supplies. While thoroughness is important, an overly burdensome process can become counterproductive, especially in a healthcare setting where timely access to supplies is critical for patient care. This approach fails to strike a balance between risk mitigation and operational efficiency, potentially leading to negative consequences for patient outcomes and organizational performance. It also suggests a misunderstanding of risk appetite and the need for proportionate risk management strategies. Professional reasoning. Professionals should approach this situation by first understanding the scope and implications of the audit findings. This involves engaging with the auditors to clarify their concerns and gathering internal data on past supplier performance and risk management activities. The next step is to critically evaluate the current supplier risk assessment framework, identifying any gaps or weaknesses. Based on this evaluation, a plan should be developed to enhance the framework, including updating risk criteria, improving assessment methodologies, and strengthening mitigation strategies. This plan should be implemented systematically, with clear timelines and assigned responsibilities. Regular monitoring and review of the risk management process are essential to ensure its ongoing effectiveness. Professionals should always strive for a balanced approach that prioritizes patient safety and organizational integrity, while ensuring efficient and timely procurement. Question 9. Market research demonstrates that a new, advanced diagnostic imaging device offers significantly improved diagnostic accuracy and reduced scan times compared to the current equipment. However, its initial purchase price is substantially higher, and it requires specialized training for technicians and a more complex integration with existing IT infrastructure. The procurement professional is tasked with evaluating this opportunity. Which approach best aligns with best practices in healthcare procurement and regulatory requirements for value analysis? Option A. Reject the new device based on its higher upfront cost, opting to continue with the existing equipment to maintain budgetary predictability. Option B. Prioritize the acquisition of the new device due to its superior clinical capabilities and potential for improved patient outcomes, initiating a detailed total cost of ownership analysis and stakeholder engagement to validate its long-term value. Option C. Delegate the decision solely to the clinical department, accepting their recommendation for the new device without a formal procurement-led value analysis process. Option D. Accept the new device based on the vendor's assurances of superior performance and future cost savings, without conducting an independent total cost of ownership analysis or extensive stakeholder consultation. Correct answer is B. Prioritize the acquisition of the new device due to its superior clinical capabilities and potential for improved patient outcomes, initiating a detailed total cost of ownership analysis and stakeholder engagement to validate its long-term value. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare procurement where a new, innovative technology promises significant clinical benefits but comes with a higher upfront cost. The procurement professional must balance the imperative to secure cost-effective solutions with the ethical and professional responsibility to ensure patients receive the best possible care. The challenge lies in rigorously evaluating the value beyond mere price, considering the total cost of ownership and the long-term clinical and operational impact, all while adhering to strict regulatory frameworks governing public healthcare spending and procurement integrity. Correct approach analysis. The correct approach emphasizes a comprehensive value analysis that extends beyond the initial purchase price. This aligns with best practices in healthcare procurement, which mandate a holistic evaluation of a product or service's worth. This includes considering clinical efficacy, patient outcomes, operational efficiency, training requirements, maintenance, disposal costs, and potential for future upgrades. By engaging relevant stakeholders, including clinicians, finance, and IT, the procurement professional ensures that the decision is informed by diverse perspectives and addresses the total cost of ownership and long-term value proposition. This approach is ethically sound as it prioritizes patient well-being and resource stewardship, and it is regulatory compliant by ensuring due diligence and a justifiable expenditure of public funds, often requiring documented evidence of value for money. Incorrect approach is analysis. One incorrect approach focuses solely on the lower upfront cost. This fails to meet the regulatory requirement for achieving value for money, as it ignores potential higher long-term operational costs, maintenance, or even suboptimal clinical outcomes that could lead to increased patient care expenses. Ethically, it risks compromising patient care by selecting a less effective or more costly-to-maintain solution in the long run, solely based on initial price. Another incorrect approach prioritizes the vendor's persuasive marketing claims without independent verification or thorough due diligence. This is a regulatory failure, as it bypasses the requirement for objective evaluation and evidence-based decision-making. Ethically, it can lead to the acquisition of substandard products or services, potentially harming patients and misusing public funds. A third incorrect approach involves deferring the decision entirely to the clinical team without a structured value analysis process. While clinical input is crucial, procurement professionals have a responsibility to ensure a robust, objective, and compliant evaluation. This approach risks overlooking critical financial, operational, and contractual considerations, potentially leading to a procurement that is not financially sustainable or operationally feasible, thus failing to meet the broader objectives of responsible public procurement. Professional reasoning. Professionals should adopt a structured, multidisciplinary approach to value analysis. This involves clearly defining evaluation criteria based on clinical needs, operational impact, and financial considerations. Engaging all relevant stakeholders early in the process is paramount. Documentation of the entire evaluation process, including the rationale for the final decision, is essential for accountability and compliance. When faced with innovative but costly solutions, professionals must rigorously assess the total cost of ownership and the demonstrable improvement in patient outcomes or operational efficiency to justify the expenditure. Ensuring alignment with both ethical obligations and regulatory mandates for prudent use of public resources. Question 10. The assessment process reveals that a healthcare procurement professional has a close personal friendship with an individual who is a principal owner of a vendor company submitting a bid for a significant contract. The professional is responsible for overseeing the evaluation of this bid. What is the most appropriate course of action for the procurement professional? Option A. Immediately disclose the personal friendship to their supervisor and the ethics committee and recuse themselves from all aspects of the bid evaluation process for that vendor. Option B. Proceed with the evaluation, confident that their professional judgment will not be influenced by the personal relationship, and ensure the bid is evaluated fairly based on merit. Option C. Discreetly adjust the evaluation criteria to subtly favor the vendor with whom they have a personal connection, believing this will ensure a positive outcome for the organization. Option D. Delegate the entire bid evaluation process for this specific vendor to a junior team member without disclosing the personal relationship, to avoid any appearance of impropriety. The correct answer is A. Immediately disclose the personal friendship to their supervisor and the ethics committee, and recuse themselves from all aspects of the bid evaluation process for that vendor. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a direct conflict between a procurement professional's personal interests and their fiduciary duty to their organization. The potential for bias, even if unintentional, can compromise the integrity of the procurement process, leading to unfair competition, suboptimal pricing, and potential legal or reputational damage. Navigating such situations requires a robust understanding of ethical guidelines and organizational policies. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing transparency and adherence to established conflict of interest policies. This involves immediate disclosure of the potential conflict to the appropriate authority, e.g., supervisor, ethics committee, and recusal from any decision-making processes related to the vendor in question. This aligns with the principles of fairness, accountability, and integrity fundamental to healthcare procurement, ensuring that decisions are made solely in the best interest of the healthcare organization and its patients, free from personal influence. This approach upholds the ethical standards expected of a certified healthcare procurement professional, CHPP. Incorrect approaches analysis. One incorrect approach involves proceeding with the evaluation without disclosure, rationalizing that personal relationships do not influence professional judgment. This is a significant ethical failure as it bypasses the organization's established conflict of interest protocols. It creates an environment where bias, whether conscious or unconscious, can seep into decision-making, potentially leading to the selection of a vendor based on personal ties rather than merit. This violates the principle of impartiality and can erode trust in the procurement process. Another incorrect approach is to attempt to mitigate the conflict by subtly favoring the vendor in the evaluation criteria without explicit disclosure. This is a form of unethical manipulation and a direct violation of procurement integrity. It undermines fair competition and can lead to the organization not securing the best value or quality. Such actions are not only unethical, but can also have legal ramifications. A third incorrect approach is to delegate the evaluation to a subordinate without informing them of the personal relationship, hoping to distance oneself from the decision. While this might seem like a way to avoid direct involvement, it is still a failure of professional responsibility. The procurement professional remains accountable for the integrity of the process, and failing to disclose the conflict to those involved in the evaluation is a breach of trust and transparency. It does not resolve the underlying conflict and can still lead to biased outcomes. Professional reasoning. Professionals should employ a decision-making framework that begins with identifying potential conflicts of interest. Upon identification, the immediate next step should be to consult the organization's conflict of interest policy and relevant ethical codes. This framework emphasizes proactive disclosure, seeking guidance from designated authorities, and recusal from any aspect of the decision-making process where a conflict exists. This ensures that all procurement activities are conducted with the highest degree of integrity and fairness, safeguarding the organization's interests and reputation. Question 11. The monitoring system demonstrates a consistent trend of sole source procurements for a specific category of high-value diagnostic reagents, with justifications citing unique vendor capabilities and urgent patient need. The procurement team has not conducted any market research to confirm the uniqueness of these capabilities, or the absence of alternative suppliers capable of meeting the urgent need within a reasonable timeframe. What is the most appropriate course of action for the procurement professional to ensure regulatory compliance and best practice? Option A. Request a formal waiver from the regulatory body to continue sole source procurements for this category of reagents indefinitely, based on the current justifications. Option B. Immediately initiate a comprehensive market analysis to identify alternative suppliers and assess the validity of the unique vendor capabilities claim, while continuing to procure the reagents on a sole source basis with enhanced oversight and documentation until the analysis is complete. Option C. Halt all sole source procurements for these diagnostic reagents and immediately initiate a full competitive bidding process, even if it causes a temporary disruption in supply. Option D. Accept the vendor's assurances regarding unique capabilities and urgent need, and continue with the sole source procurement process as it has been, focusing on negotiating the best possible price. The correct answer is B. Immediately initiate a comprehensive market analysis to identify alternative suppliers and assess the validity of the unique vendor capabilities claim, while continuing to procure the reagents on a sole source basis with enhanced oversight and documentation until the analysis is complete. Explanation. The monitoring system demonstrates a recurring pattern of sole source procurements for critical medical supplies, bypassing competitive bidding processes. This scenario is professionally challenging because it directly implicates adherence to fundamental principles of healthcare procurement, specifically those designed to ensure fairness, transparency, and value for money. The pressure to ensure immediate availability of essential supplies can create a tension with the regulatory requirement for competitive processes, demanding careful judgment to balance operational needs with compliance. The correct approach, which involves a thorough review of the justification for sole source procurement against established regulatory thresholds and documentation requirements, represents best professional practice. This aligns with the core tenets of healthcare procurement regulations, which mandate that sole source justifications must be robust, well-documented, and demonstrably in the best interest of the healthcare organization, and by extension, patient care. This approach ensures that deviations from competitive bidding are exceptions, not the norm, and are rigorously scrutinized to prevent potential fraud, waste, and abuse. It upholds the ethical obligation to steward public or organizational funds responsibly. An incorrect approach that involves continuing the sole source pattern without adequate justification or documentation fails to comply with regulatory frameworks. This could lead to violations of procurement laws that require competitive processes unless specific exemptions are met. Ethically, it undermines transparency and fairness, potentially leading to inflated prices and reduced quality of goods. Another incorrect approach, which is to immediately halt all sole source procurements and revert to a potentially inefficient or delayed competitive process for critical items, ignores the regulatory allowances for sole source when genuinely justified and documented. This can jeopardize patient care by creating supply chain disruption. A further incorrect approach, which is to rely solely on vendor assurances without independent verification or adherence to internal policy, represents a significant lapse in due diligence and regulatory compliance, exposing the organization to risks and potential penalties. Professionals should employ a decision-making framework that prioritizes understanding the specific regulatory requirements for sole source procurements within the CHPP jurisdiction. This involves assessing the nature of the critical supply, the market availability, and the documented justification provided. If a sole source procurement is deemed necessary, the process must meticulously follow all procedural steps, including obtaining appropriate approvals and maintaining comprehensive documentation. When in doubt, seeking guidance from legal counsel or senior procurement leadership is essential to navigate complex situations and ensure full compliance. Question 12. The performance metrics show a consistent decline in on-time delivery rates and an increase in reported product defects for a critical medical supply vendor over the past 2 quarters. The procurement team is aware that this vendor has historically offered competitive pricing, but the recent performance trends raise concerns about potential disruptions to patient care and increased costs associated with product returns and replacements. Which of the following actions best represents a proactive and ethically sound approach to managing this supplier relationship? Option A. Immediately initiate a competitive bidding process to secure a new supplier for the critical medical supply, citing the declining performance metrics as justification for the expedited process. Option B. Schedule a formal meeting with the current supplier to discuss the specific performance metrics, understand the root causes of the issues, and collaboratively develop a corrective action plan with defined timelines and measurable outcomes. Option C. Inform the supplier that their contract will be terminated within 30 days due to non-compliance with delivery and quality standards, without further discussion or attempts at remediation. Option D. Continue with the current supplier, assuming the price advantage outweighs the minor performance deviations, and address any immediate supply shortages on a case-by-case basis as they arise. The correct answer is A. Immediately initiate a competitive bidding process to secure a new supplier for the critical medical supply, citing the declining performance metrics as justification for the expedited process. Explanation: this scenario presents a common challenge in healthcare procurement, balancing the need for cost-effectiveness with the imperative of ensuring patient safety and supply chain resilience. The performance metrics reveal a potential disconnect between the current supplier's operational efficiency and the healthcare organization's strategic goals for patient care and risk mitigation. The professional challenge lies in interpreting these metrics not just as financial indicators, but as signals of potential risks to service delivery and patient outcomes, requiring a nuanced approach to supplier relationship management. The correct approach emphasizes proactive engagement and collaborative problem-solving with the supplier. This aligns with best professional practice in healthcare procurement, which prioritizes long-term value and risk management over short-term cost savings. By initiating a dialogue to understand the root causes of the performance dips and jointly developing corrective actions, the procurement professional upholds ethical obligations to ensure the availability of critical medical supplies and services. This collaborative strategy also fosters a stronger supplier relationship, which is crucial for future innovation, responsiveness, and supply chain stability, all of which are indirectly mandated by the principles of good governance and patient welfare inherent in healthcare regulations. An incorrect approach that focuses solely on immediate cost reduction by seeking alternative suppliers without a thorough understanding of the current supplier's issues risks disrupting the supply chain. This could lead to shortages of essential medical products, directly impacting patient care and potentially violating regulatory requirements related to the continuity of healthcare services. Furthermore, abruptly terminating a relationship without due diligence or a clear, documented rationale based on contractual breaches or significant performance failures could expose the organization to legal challenges and reputational damage. Another incorrect approach, which involves ignoring the performance metrics and continuing with the status quo, represents a failure in due diligence and risk management. This inaction allows potential issues to fester, increasing the likelihood of future disruptions and compromising the organization's ability to meet its patient care obligations, which is a fundamental ethical and, in many cases, regulatory responsibility. Professionals should approach such situations by first thoroughly analyzing the performance data in the context of contractual obligations and strategic objectives. This involves understanding the impact of supplier performance on patient care, operational efficiency, and financial health. The next step is to engage the supplier constructively, seeking to understand the underlying issues and collaboratively developing a remediation plan. If remediation is unsuccessful or the issues are systemic and unresolvable, then a more formal process of performance review, potential contract renegotiation, or, as a last resort, seeking alternative suppliers, should be initiated, always with a clear audit trail and adherence to procurement policies and ethical guidelines. Question 13. Operational review demonstrates that a critical piece of diagnostic equipment is nearing the end of its service life. The procurement team is evaluating replacement options. One option presents a significantly lower upfront purchase price compared to others, but the vendor's service and maintenance contracts are notably more expensive over a 5-year period. The team is under pressure to meet immediate capital expenditure targets, which approach best aligns with the principles of responsible healthcare procurement and total cost of ownership (TCO) analysis. Option A. Conduct a comprehensive total cost of ownership (TCO) analysis that includes acquisition, installation, operational costs, maintenance, training, and disposal, comparing the total lifecycle costs of all viable options. Option B. Prioritize the option with the lowest upfront purchase price to meet immediate capital expenditure targets, assuming future operational costs can be managed. Option C. Focus on the option with the lowest annual maintenance contract cost, as this represents a significant portion of ongoing expenditure and is easier to budget for. Option D. Select the option from a well-established and reputable brand, even if its TCO is projected to be higher due to perceived reliability and reduced risk. Correct answer is B. Prioritize the option with the lowest upfront purchase price to meet immediate capital expenditure targets, assuming future operational costs can be managed. Explanation: Scenario analysis. This scenario is professionally challenging because it requires procurement professionals to move beyond the initial purchase price and consider the long-term financial implications of a decision. The pressure to meet immediate budget constraints can often overshadow the strategic benefits of a more comprehensive total cost of ownership (TCO) analysis. This requires a shift in mindset and the ability to articulate the value of future savings and avoided costs to stakeholders who may be focused on short-term expenditures. The complexity lies in identifying, quantifying, and justifying all relevant cost components over the life cycle of the asset or service. Correct approach analysis. The correct approach involves a thorough TCO analysis that incorporates all relevant lifecycle costs, including acquisition, installation, operation, maintenance, training, disposal, and potential downtime. This aligns with best practices in healthcare procurement, which emphasize value for money and long-term sustainability. By considering these factors, procurement professionals can make informed decisions that optimize resource allocation, reduce overall expenditure, and improve patient care outcomes by ensuring reliable and efficient equipment or services. This approach is ethically sound as it prioritizes the responsible stewardship of public or organizational funds and upholds the duty to secure the best value for the healthcare entity. Incorrect approaches analysis. One incorrect approach focuses solely on the lowest upfront purchase price. This fails to meet regulatory requirements for prudent financial management and can lead to significant hidden costs later in the life cycle, such as higher maintenance expenses, frequent repairs, or premature replacement. Ethically, this approach can be seen as a failure to act in the best interest of the organization and its patients by potentially compromising the quality and reliability of essential healthcare resources. Another incorrect approach might prioritize the vendor's perceived reputation or brand name without a rigorous assessment of their TCO offering. While brand can be a factor, it should not supersede a data-driven TCO analysis. This can lead to overpaying for a product or service that does not offer the best long-term value, potentially diverting funds that could be used for other critical healthcare needs. This is a failure to conduct due diligence and secure the most economically advantageous solution. A third incorrect approach could involve neglecting to account for the costs associated with training staff on new equipment or the potential disruption to services during implementation. These soft costs, while harder to quantify, can have a substantial impact on the overall TCO and operational efficiency. Ignoring them leads to an incomplete and misleading TCO calculation, potentially resulting in budget overruns and operational inefficiencies, which are detrimental to patient care. Professional reasoning. Professionals should adopt a systematic approach to TCO analysis. This involves 1. Defining the scope and life cycle of the asset or service. 2. Identifying all potential cost categories, both direct and indirect, tangible and intangible. 3. Gathering reliable data for each cost category, often requiring collaboration with operational departments, finance, and IT. 4. Analyzing and comparing the TCO of different options, considering risk and uncertainty. 5. Documenting the analysis and presenting findings clearly to stakeholders, emphasizing the long-term value proposition. This structured process ensures compliance with procurement regulations and ethical obligations to maximize value and ensure the efficient delivery of healthcare services. Question 14. Governance review demonstrates that the healthcare organization faces an urgent need to secure a reliable supply of a critical, high-volume medical device due to an unexpected surge in demand and potential disruptions from existing suppliers. The procurement department is under pressure to act swiftly to avoid stockouts that could impact patient care. Considering the principles of strategic sourcing and the regulatory framework for healthcare procurement, which of the following approaches best balances the immediate need with long-term organizational objectives? Option A. Expedite the procurement by issuing a request for proposal (RFP) to a limited list of known suppliers, prioritizing those with the lowest quoted unit price for the device. Option B, initiate a rapid, multi-stage strategic sourcing process that includes thorough market analysis, supplier pre-qualification based on critical capabilities and financial stability, and a competitive evaluation of proposals focusing on total cost of ownership, supply chain resilience, and quality assurance. Option C, immediately award a sole source contract to the largest, most established supplier currently providing similar devices, assuming their capacity can meet the increased demand and their pricing is acceptable for the short term. Option D, bypass the formal sourcing process and direct the purchasing department to secure the necessary quantities through existing framework agreements, even if those agreements do not fully cover the specific device or optimal terms. Correct answer is B. Initiate a rapid, multi-stage strategic sourcing process that includes thorough market analysis, supplier pre-qualification based on critical capabilities and financial stability, and a competitive evaluation of proposals focusing on total cost of ownership, supply chain resilience, and quality assurance. Explanation: scenario analysis. This scenario is professionally challenging because it requires balancing the immediate need for critical medical supplies with the long-term strategic goals of cost containment and supplier diversification. The pressure to secure supply quickly can lead to short-sighted decisions that undermine future procurement effectiveness and potentially violate procurement principles if not handled judiciously. Careful judgment is required to navigate these competing demands while adhering to regulatory frameworks. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a structured, data-driven strategic sourcing process even under pressure. This involves a thorough market analysis to understand supplier capabilities, pricing, and potential risks, followed by a robust evaluation of potential suppliers against defined criteria. This aligns with the principles of fair competition, transparency, and value for money, which are fundamental to healthcare procurement regulations. By engaging with a broader supplier base and considering total cost of ownership, the organization mitigates risks associated with single sourcing and positions itself for better long-term outcomes, demonstrating due diligence and responsible stewardship of public funds. Incorrect approaches analysis. One incorrect approach involves immediately awarding a contract to the first supplier that can meet the immediate demand without a comprehensive evaluation. This fails to adhere to principles of fair and open competition, potentially leading to inflated prices and suboptimal terms. It also misses the opportunity to identify more capable or cost-effective suppliers, thereby failing to achieve best value and potentially violating procurement regulations that mandate competitive processes. Another incorrect approach is to bypass the formal sourcing process entirely and rely solely on existing, potentially limited, supplier relationships. This creates a significant risk of vendor lock-in, limits innovation, and can lead to higher costs over time. It also raises concerns about fairness and transparency, as it may exclude potentially better qualified suppliers and could be seen as a deviation from established procurement policies and regulations designed to ensure equitable treatment of all vendors. A third incorrect approach is to focus exclusively on the lowest price without considering the supplier's reliability, quality of products, or long-term viability. While cost is a critical factor, a sole focus on price can lead to the procurement of substandard goods, supply chain disruptions, and increased total cost of ownership due to issues like returns, replacements, or contract failures. This approach neglects the broader strategic objectives of ensuring a resilient and high-quality supply chain, which is paramount in healthcare. Professional reasoning. Professionals should employ a decision-making framework that begins with clearly defining the procurement need and its urgency. This should be followed by an assessment of the regulatory requirements and internal policies governing the procurement process. A risk assessment should then be conducted to understand the potential impacts of different sourcing strategies. The process should involve stakeholder engagement to gather input and ensure alignment. Finally, a structured evaluation methodology, based on predefined criteria that balance cost, quality, risk, and strategic fit, should be applied to select the most appropriate supplier or sourcing strategy, ensuring transparency and accountability throughout. Question 15. Assessment of the most effective method for establishing and monitoring performance metrics for healthcare suppliers, ensuring compliance with U.S. healthcare procurement regulations and safeguarding patient safety, would prioritize which of the following? Option A. relying primarily on informal feedback from clinical staff and anecdotal evidence of supplier responsiveness to gauge performance. Option B, developing contractually defined, objective, and measurable key performance indicators, KPI, directly linked to patient care quality, service reliability, and regulatory adherence, with a robust system for regular data collection and review. Option C, implementing a system where performance is assessed only when a significant complaint or adverse event is reported. Option D, focusing exclusively on achieving the lowest possible unit cost for all procured goods and services, assuming quality will naturally follow price. The correct answer is B, developing contractually defined, objective, and measurable key performance indicators, KPI, directly linked to patient care quality, service reliability, and regulatory adherence, with a robust system for regular data collection and review. Explanation. The scenario presents a common challenge in healthcare procurement. Ensuring supplier performance aligns with contractual obligations and regulatory expectations, particularly concerning patient safety and quality of care. The professional challenge lies in balancing the need for cost-effectiveness with the imperative to maintain high standards of service and product quality, all while adhering to the specific regulatory framework governing healthcare procurement in the United States. This requires a nuanced understanding of performance metrics that are both measurable and directly linked to patient outcomes and compliance. The correct approach represents best professional practice because it focuses on objective, verifiable metrics that directly impact patient care and operational efficiency, aligning with the principles of good stewardship and accountability mandated by U.S. healthcare regulations. By establishing clear, measurable key performance indicators, KPI, that are contractually defined and regularly monitored, procurement professionals can proactively identify and address performance issues before they compromise patient safety or lead to regulatory noncompliance. This proactive stance is crucial in a sector where failures can have severe consequences. An incorrect approach that relies solely on subjective feedback or anecdotal evidence is professionally unacceptable. This method lacks objectivity and is prone to bias, making it difficult to demonstrate compliance or justify corrective actions. It fails to meet the standards of due diligence required by U.S. healthcare procurement regulations, which emphasize evidence-based decision-making. Furthermore, it can lead to inconsistent application of standards and potential disputes with suppliers. Another incorrect approach that focuses exclusively on cost reduction without considering performance implications is also a significant regulatory and ethical failure. U.S. healthcare procurement regulations, such as those related to the Federal Acquisition Regulation, FAR, and state-specific healthcare laws, emphasize value for money, which includes not just price but also quality, reliability, and safety. Prioritizing cost above all else can lead to the selection of substandard products or services, increasing the risk of patient harm, operational disruptions, and ultimately, higher long-term costs due to rework, recalls, or adverse events. This approach neglects the fundamental responsibility to ensure the procurement process supports the delivery of safe and effective patient care. The professional decision-making process for similar situations should involve a systematic evaluation of potential suppliers based on a comprehensive set of criteria. This includes defining clear, measurable performance metrics that are directly relevant to the healthcare service or product being procured. These metrics should be incorporated into the contract and form the basis for ongoing performance reviews. Procurement professionals must also consider the supplier's track record, quality management systems, and ability to meet regulatory requirements. Regular communication and collaboration with suppliers are essential to foster a partnership focused on continuous improvement and shared accountability for patient outcomes. When performance issues arise, a structured process for addressing them, including clear escalation procedures and potential remedies, should be in place, always grounded in contractual terms and regulatory compliance. Question 16. Comparative studies suggest that in healthcare procurement, the effectiveness of transparency and accountability measures can vary significantly based on the implementation strategies employed. Considering the regulatory framework for Certified Healthcare Procurement Professional (CHPP) examinations, which focuses on U.S. federal procurement laws and regulations, which of the following approaches best upholds these principles? Option A. Proactively publishing all tender opportunities and detailed evaluation criteria on a publicly accessible government procurement portal, establishing a clear and accessible process for vendor inquiries and protests, and maintaining comprehensive documentation of all procurement decisions and their justifications. Option B. Awarding contracts based primarily on the lowest bid received, without a thorough evaluation of the vendor's capacity to meet the specific clinical and operational needs of the healthcare facility. Option C. Limiting the dissemination of tender opportunities to a pre-approved list of vendors known for their long-standing relationships with the healthcare organization, thereby expediting the selection process. Option D. Relying on informal communication channels and verbal agreements with preferred vendors to ensure timely delivery of critical medical supplies, with detailed documentation only being compiled post-delivery. The correct answer is A. Proactively publishing all tender opportunities and detailed evaluation criteria on a publicly accessible government procurement portal, establishing a clear and accessible process for vendor inquiries and protests, and maintaining comprehensive documentation of all procurement decisions and their justifications. Explanation: this scenario is professionally challenging because it requires balancing the need for efficient procurement with the fundamental principles of transparency and accountability, as mandated by healthcare procurement regulations. The procurement professional must navigate potential conflicts between speed and due diligence, ensuring that all actions are defensible and align with ethical standards and legal requirements. The pressure to deliver essential healthcare goods and services quickly can sometimes create an environment where shortcuts are tempting, but these can lead to significant compliance risks and damage public trust. The correct approach represents best professional practice because it prioritizes adherence to established regulatory frameworks designed to prevent fraud, waste, and abuse. By proactively implementing and documenting robust transparency measures, such as publicizing tender opportunities, making evaluation criteria clear and accessible, and establishing a clear appeals process, the procurement professional ensures accountability. This aligns directly with the core tenets of public sector procurement, particularly in healthcare where public funds are involved and patient well-being is at stake. Regulatory frameworks for healthcare procurement, such as those governed by the Federal Acquisition Regulation, FAR in the U.S., emphasize fair competition, equal opportunity, and the responsible use of taxpayer money. Transparency in these processes is not merely a procedural step, but a critical mechanism for ensuring that decisions are made in the best interest of the healthcare system and its beneficiaries. An incorrect approach that involves limiting the dissemination of tender information to a select few vendors, even if those vendors are perceived as highly capable, represents a significant regulatory and ethical failure. This violates principles of fair competition and equal opportunity, which are cornerstones of procurement law. It creates an environment ripe for favoritism and potential collusion, undermining the integrity of the procurement process and potentially leading to inflated prices or substandard goods. Such an action would be a direct contravention of regulations requiring open and competitive bidding. Another incorrect approach, such as failing to document the rationale behind vendor selection, even when a seemingly logical choice is made, is also a critical failure. Accountability requires a clear audit trail. Without documented justification, it becomes impossible to demonstrate that the selection was based on objective criteria and in the best interest of the healthcare organization. This lack of documentation leaves the process vulnerable to accusations of bias or impropriety and hinders any subsequent review or audit, violating the spirit and letter of accountability requirements in procurement regulations. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understanding the specific regulatory requirements applicable to the healthcare procurement at hand. Second, identifying potential risks to transparency and accountability inherent in the procurement strategy. Third, designing and implementing controls and procedures that mitigate these risks, such as clear communication protocols, robust documentation standards, and independent review mechanisms. Finally, continuously monitoring the procurement process to ensure ongoing compliance and ethical conduct, and being prepared to justify all decisions with clear, documented evidence. Question 17. Risk assessment procedures indicate that a critical healthcare service procurement requires a contract structure that incentivizes high-quality patient outcomes and efficient resource utilization while mitigating the risk of service disruption. Considering the complex and dynamic nature of healthcare delivery, which contract type would best align with these objectives and adhere to best practices in healthcare procurement? Option A. Time and materials contract, where the supplier is reimbursed for the actual time spent and materials used, with no predefined performance metrics or cost ceilings. Option B, a performance-based contract with clearly defined key performance indicators, KPI tied to patient satisfaction, clinical effectiveness, and operational efficiency, including financial incentives for exceeding targets and penalties for failing to meet minimum standards. Option C, a fixed-price contract with a detailed scope of work, assuming all potential operational variables are fully predictable and manageable within the initial cost estimate. Option D, a cost-plus contract with a percentage of cost fee, allowing for full reimbursement of all documented costs, plus a predetermined percentage for profit, with minimal oversight on cost drivers. The correct answer is B, a performance-based contract with clearly defined key performance indicators, KPI, tied to patient satisfaction, clinical effectiveness, and operational efficiency, including financial incentives for exceeding targets and penalties for failing to meet minimum standards. Explanation: this scenario is professionally challenging because selecting the appropriate contract type for a complex healthcare service procurement requires a nuanced understanding of risk allocation, performance incentives, and the specific operational realities of the service. Misjudging the contract structure can lead to significant financial overruns, service quality degradation, and potential noncompliance with healthcare regulations. Careful judgment is required to balance the needs of the procuring entity with the capabilities and risks of the supplier. Correct approach represents best professional practice because it aligns the contract structure with the specific nature of the healthcare service and the desired outcomes. A performance-based contract, particularly one with clearly defined key performance indicators, KPI, and associated financial incentives or penalties, directly addresses the need for high-quality, reliable healthcare delivery. This structure encourages the supplier to focus on achieving measurable outcomes, which is paramount in healthcare where patient well-being is the ultimate objective. This approach is supported by general principles of effective procurement and is consistent with the ethical imperative to ensure value for money and quality of care, as often implicitly or explicitly required by healthcare procurement guidelines that emphasize outcomes and accountability. An incorrect approach that focuses solely on a fixed-price contract without performance metrics fails to adequately manage the inherent risks in healthcare service delivery. Healthcare services are often subject to unforeseen variables, such as patient acuity, technological advancements, and regulatory changes, which can significantly impact costs and service delivery. A fixed-price contract without performance linkages can lead to the supplier cutting corners to maintain profitability, potentially compromising patient care, which is an ethical and regulatory failure. It also fails to incentivize innovation or continuous improvement. Another incorrect approach, opting for a cost-plus contract without robust oversight and defined profit caps, shifts excessive financial risk to the procuring entity. While it may offer flexibility, it can lead to uncontrolled expenditure and a lack of incentive for the supplier to manage costs efficiently. This can result in poor value for money and potential overspending, which is a failure in fiduciary responsibility and can contravene procurement principles requiring cost-effectiveness. A third incorrect approach, choosing a simple time and materials contract for a complex, long-term healthcare service, is also professionally unacceptable. This structure offers minimal incentive for efficiency or quality and can lead to unpredictable costs and a lack of clear accountability for service outcomes. It fails to align the supplier's interests with the procuring entity's need for predictable service delivery and cost management, potentially leading to disputes and a breakdown in the supplier relationship. This approach neglects the fundamental procurement principle of achieving best value and managing supplier performance effectively. Professionals should employ a decision-making framework that begins with a thorough needs assessment and risk analysis of the service to be procured. This should be followed by an evaluation of different contract structures, considering their suitability for managing identified risks, incentivizing desired performance, and ensuring value for money. The chosen contract type must be clearly defined with measurable performance indicators and appropriate mechanisms for monitoring, evaluation, and dispute resolution, all within the bounds of applicable healthcare procurement regulations and ethical standards. Question 18. To address the challenge of integrating environmental sustainability into healthcare procurement decisions, which approach best aligns with regulatory frameworks and ethical best practices for a certified healthcare procurement professional? Option A. Focus exclusively on the clinical efficacy and safety of products, deferring any environmental sustainability considerations to a separate, non-integrated initiative that does not impact the core procurement decision-making process. Option B. Adopt a reactive approach, addressing environmental sustainability concerns only when mandated by specific regulations or when significant public pressure arises, without proactive integration into procurement strategies or supplier relationships. Option C. Develop and implement a comprehensive sustainable procurement policy that includes specific environmental criteria for product evaluation, supplier engagement on sustainability performance, and life cycle cost considerations, ensuring alignment with organizational sustainability goals and regulatory requirements. Option D. Prioritize the lowest initial purchase price for all goods and services, as cost containment is the primary objective in healthcare procurement, with environmental considerations being secondary and addressed only if no additional cost is incurred. Correct answer is C. Develop and implement a comprehensive sustainable procurement policy that includes specific environmental criteria for product evaluation, supplier engagement on sustainability performance, and life cycle cost considerations, ensuring alignment with organizational sustainability goals and regulatory requirements. Explanation. The scenario presents a common challenge in healthcare procurement, balancing the imperative for environmental sustainability with the immediate needs of patient care and budgetary constraints. The professional challenge lies in navigating complex stakeholder expectations, diverse product life cycles, and the evolving regulatory landscape for sustainable procurement within the healthcare sector. Careful judgment is required to ensure that environmental considerations do not compromise patient safety, clinical efficacy, or financial viability, while still advancing the organization's sustainability goals. The correct approach represents best professional practice because it integrates environmental sustainability criteria directly into the procurement decision-making framework, aligning with the principles of responsible sourcing and long-term value creation. This approach is justified by the growing body of regulations and ethical guidelines that mandate or encourage environmental considerations in public and healthcare procurement. By establishing clear metrics and engaging stakeholders, this method ensures transparency, accountability, and a systematic progression towards achieving sustainability objectives without jeopardizing core healthcare functions. It reflects a proactive and strategic integration of environmental stewardship into the procurement process, an incorrect approach that prioritizes cost savings above all else, without considering the environmental impact of product choices, fails to meet regulatory expectations for sustainable procurement and ethical sourcing. This can lead to higher long-term environmental costs, reputational damage, and potential noncompliance with emerging environmental legislation. Another incorrect approach that focuses solely on the initial purchase price, ignoring the total life cycle cost including disposal and energy consumption, is also professionally unacceptable. This overlooks significant environmental externalities and can result in higher operational costs and greater environmental burden over time, contradicting the principles of value for money and responsible resource management. An approach that relies on ad hoc, uncoordinated sustainability initiatives without a structured framework risks inefficiency, lack of measurable progress, and potential conflicts with established procurement policies and procedures. This demonstrates a lack of strategic foresight and commitment to embedding sustainability into the organizational culture and operations. Professionals should employ a decision-making framework that involves 1. Identifying and prioritizing environmental impact areas relevant to healthcare procurement, e.g., waste reduction, energy efficiency, sustainable materials. 2. Developing clear, measurable sustainability criteria for product evaluation. 3. Engaging with suppliers to understand their environmental performance and encourage innovation. 4. Conducting lifecycle cost assessments that incorporate environmental factors. And 5. Establishing robust monitoring and reporting mechanisms to track progress and ensure accountability. This systematic approach ensures that environmental sustainability is a core component of procurement strategy, not an afterthought. Question 19. Operational review demonstrates a critical shortage of a life-saving medication due to an unexpected supply chain disruption, posing an immediate risk to patient care. The procurement department is under immense pressure to secure a new supply within 48 hours, What is the most appropriate procurement approach to address this urgent situation while adhering to regulatory and ethical standards? Option A. Immediately initiate an emergency procurement process, documenting the justification for urgency and seeking necessary approvals for a sole source or limited source acquisition, while ensuring a post-award review for compliance and value. Option B. Rely on informal verbal agreements with known vendors to expedite the order, without formal purchase orders or contracts, to save time. Option C. Proceed with acquiring the medication from the most readily available vendor, without any formal documentation or adherence to emergency procurement clauses, prioritizing speed above all else. Option D. Delay the acquisition to conduct a full, standard competitive bidding process to ensure the lowest possible price, even if it means exceeding the 48-hour timeframe. The correct answer is A. Immediately initiate an emergency procurement process, documenting the justification for urgency and seeking necessary approvals for a sole source or limited source acquisition, while ensuring a post-award review for compliance and value. Explanation. Scenario analysis. This scenario presents a common implementation challenge in healthcare procurement, balancing the need for rapid acquisition of critical supplies with the imperative to adhere to established procurement policies and regulatory frameworks. The pressure to act quickly can lead to shortcuts that, while seemingly efficient in the short term, can expose the organization to significant risks, including non-compliance, compromised quality, and potential fraud. The professional challenge lies in navigating these competing demands while upholding ethical standards and ensuring the best value for the organization and, ultimately, patient care. Correct approach analysis. The correct approach emphasizes a structured, policy-driven response that acknowledges the urgency but does not bypass essential controls. This aligns with the principles of good governance and responsible stewardship of public or organizational funds, which are paramount in healthcare procurement. Specifically, it involves a documented justification for expedited procurement, a clear understanding of the emergency procurement provisions within the organization's policies, and relevant U.S. federal regulations, e.g., FAR if applicable to the specific healthcare entity's funding or operational context, or HHS procurement guidelines, and a commitment to post-award review to ensure compliance and value. This approach safeguards against potential audit findings, legal challenges, and reputational damage, while still enabling timely access to necessary resources. It demonstrates a commitment to transparency and accountability, core tenets of professional procurement practice. Incorrect approaches analysis. One incorrect approach involves proceeding with the acquisition without any formal documentation or adherence to emergency procurement clauses. This is a direct violation of procurement policies and potentially federal or state regulations governing public funds or healthcare operations. It creates a significant audit risk, as there is no justification for deviating from standard procedures. Ethically, it undermines the principles of fairness and competition, even in an emergency, by not establishing a clear rationale for bypassing these. Another incorrect approach is to delay the acquisition significantly to conduct a full, standard competitive bidding process, even when the situation clearly warrants an expedited response. While adherence to policy is important, an overly rigid application in an emergency can lead to patient harm or operational failure, which is contrary to the primary mission of a healthcare organization. This demonstrates a lack of professional judgment in assessing the true urgency and impact of the situation. A third incorrect approach is to rely solely on informal verbal agreements or assurances from vendors without any written documentation or contractual basis. This exposes the organization to significant legal and financial risks, including disputes over pricing, delivery, or quality. It also bypasses critical due diligence and risk assessment steps that are fundamental to responsible procurement. Such an approach is unprofessional and highly susceptible to fraud and abuse. Professional reasoning. Professionals in healthcare procurement must develop a robust decision-making framework that integrates policy, regulation, ethical considerations, and situational awareness. This involves 1. Rapidly assessing the true nature and urgency of the need, considering potential impacts on patient care and operations. 2. Consulting and understanding the organization's procurement policies, particularly emergency procurement provisions, and relevant U.S. federal or state regulations. 3. Documenting the justification for any deviation from standard procedures, including the rationale for the chosen procurement method. 4. Ensuring appropriate oversight and approval, even for expedited processes. 5. Planning for post-award review to confirm compliance and value. This systematic approach allows for agility in emergencies while maintaining integrity and accountability. Question 20. Operational review demonstrates that a critical medical device supplier is experiencing significant financial headwinds, evidenced by recent credit rating downgrades and increased supplier payment delays. However, this supplier is the sole provider of a unique, life-saving device with no immediate alternative available in the market. The procurement team is under pressure to secure a new contract to ensure uninterrupted supply. Which of the following approaches best addresses the multifaceted risks in this supplier evaluation scenario? Option A. Rely on the supplier's existing long-standing reputation and certifications, assuming their financial challenges are temporary and will not impact their ability to deliver. Option B. Award the contract to the supplier based on their sole source status and the critical nature of the device, deferring detailed financial due diligence until after the contract is secured. Option C. Conduct a comprehensive risk assessment that integrates the supplier's financial viability, quality management systems, and supply chain resilience, alongside exploring interim mitigation strategies for supply continuity. Option D. Prioritize securing the lowest possible price for the device, assuming that financial difficulties may lead the supplier to offer significant discounts. The correct answer is C. Conduct a comprehensive risk assessment that integrates the supplier's financial viability, quality management systems, and supply chain resilience, alongside exploring interim mitigation strategies for supply continuity. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a procurement professional to balance the immediate need for essential medical supplies with the long-term risks associated with a supplier's financial instability. The pressure to secure supply can lead to overlooking critical risk factors, potentially jeopardizing patient care and organizational financial health. Careful judgment is required to ensure that the evaluation criteria are robust and consistently applied, even under pressure. Correct approach analysis. The correct approach emphasizes a comprehensive risk assessment that integrates financial viability, quality control, and supply chain resilience. This aligns with the principles of responsible healthcare procurement, which mandate due diligence to ensure continuity of care and patient safety. Specifically, evaluating a supplier's financial health is crucial to mitigate the risk of supply disruption due to bankruptcy or insolvency. Assessing their quality management systems, e.g., ISO certifications, past audit results, directly addresses patient safety and product efficacy. Furthermore, understanding their supply chain robustness, e.g., contingency plans, geographical diversification, is vital to anticipate and manage potential disruptions, which is a core tenet of healthcare supply chain management. This holistic approach ensures that the chosen supplier can reliably meet the organization's needs without introducing unacceptable risks, thereby upholding ethical obligations to patients and stakeholders. Incorrect approach is analysis. Focusing solely on the lowest price without a thorough risk assessment is a significant regulatory and ethical failure. This approach prioritizes cost savings over patient safety and supply chain reliability, which can lead to the procurement of substandard products or disruptions in critical supply lines. Such a failure violates the duty of care inherent in healthcare procurement. Prioritizing a supplier's established reputation without verifying current financial stability and operational capacity is also problematic. While reputation is a factor, it does not guarantee current performance or future reliability. A once reputable supplier could be experiencing significant financial distress or operational issues that are not publicly apparent, leading to potential supply chain disruptions and compromising patient care. This oversight fails to meet the due diligence requirements of prudent procurement. Relying exclusively on a supplier's self-reported compliance with regulations without independent verification or a robust risk assessment framework is another critical failure. Self-reporting can be inaccurate or incomplete. A thorough evaluation requires independent verification of quality certifications, financial health, and operational capabilities to ensure genuine compliance and mitigate risks effectively. This approach neglects the essential verification step, leaving the organization vulnerable to undisclosed risks. Professional reasoning. Healthcare procurement professionals must adopt a risk-based approach to supplier evaluation. This involves developing a framework that systematically identifies, assesses, and mitigates potential risks. Key considerations include financial stability, quality assurance processes, supply chain resilience, ethical conduct, and regulatory compliance. When evaluating suppliers, professionals should 1. Define clear, objective evaluation criteria aligned with organizational needs and regulatory requirements. 2. Conduct thorough due diligence, including financial checks, site visits, and review of quality certifications and audit reports. 3. Assess the supplier's capacity to meet demand and their contingency plans for disruptions. 4. Document the entire evaluation process and the rationale for supplier selection. 5. Regularly review supplier performance and reassess risks throughout the contract lifecycle. This systematic and risk-aware approach ensures that procurement decisions support patient care, financial stewardship, and organizational integrity.